Welcome to the Jonathan Kinloch Show. Today on the Jonathan Kinloch Show, we have Mike Duggan. You know him as the CEO of DMC, but he wants to get you familiar with what he's doing over there at DMC and the impact that it's having here on our local economy. Healthcare reform is on the way, and we're going to talk to him about the impact that the new Affordable Health Care Act will have on Michigan residents. So we'll be right back with Mike Duggan, CEO of DMC. Welcome back. Mike Duggan is the Chief Executive Officer of the Detroit Medical Center. He's been at DMC for the past 9 years. It is a number of different projects that are taking place on various different campuses and facilities owned by DMC that is sparking a lot of synergy and a lot of excitement here in Metro Detroit. Mike Duggan, I want to welcome you to the show.
Thanks, Jonathan. Thanks for having me on.
Well, your name has been in the news of recent because of some interest that has been tossed about running for mayor, as well as the major construction projects that are taking place over at DMC, and not too long ago, the merger between Vanguard and DMC. So DMC and you have basically been an integral part of this community, and of late has definitely been in the news media. So I wanted to invite you on the show to actually find out a couple of things. First and foremost, who is Mike Duggan?
Well, I'm the guy that just resigned from the Detroit Medical Center. So I'm going to be unemployed in about 6 weeks, which will be a new experience for me. I've been working pretty hard for a lot of years. You know, I was born in this community. I lived as a young boy in the Fenkel and Schaefer area. I went to high school at Catholic Central when it was on West Outer Drive. And I have worked in this city from my first day out of school in the early 1980s. It's been more than 30 years. And I love the city. I love being a part of it. And I think what the team did at the Detroit Medical Center was extremely important for Detroit's future, and I'm proud of it.
Well, a lot of folks are familiar with your trisque over in Wayne County, from serving as the Deputy County Executive to then being elected as the County Prosecutor here in Wayne County. But how did all of that prepare you and also launch you for your experience over at DMC?
Well, you know, in Wayne County, I was the Deputy County Executive, and we came in the 80s with a $130 million deficit on a $200 million budget. It was every bit as bad as the city of Detroit's finances today. In fact, people forget this. Before Ed McNamara came to office, Wayne County had run a deficit 17 years in a row. It was an astonishing record, and people thought that it was hopeless. But we put a package together that cut our costs, that got more revenue from Lansing, that had some union concessions but full union support on the package. We balanced the budget, and it stayed balanced for the next 15 years. And managing that was a key thing. The second thing was in the early 90s, when the SMART bus system was running out of cash and the board had voted to close it, the unions at SMART came to me and asked me to serve as the general manager. And I did that for 4 years and took a bus system that was in huge deficit. We restructured the routes, made it run more efficiently, and ultimately got a millage passed in Wayne, Oakland, and Macomb County, and got that balanced. So by the time I had gotten to DMC, I had a track record of financial turnarounds, and that was really why the DMC board had recruited me.
Well, DMC also was recently facing some challenges because of the whole dynamics that occurring in the medical industry. And there was a climate that presented itself that allowed for the outside interests to take a look at DMC and what you were doing over at DMC, and presented a partnership offer. That offer came through Vanguard.
Right, and so you have to go back to the history of why we were attractive to a national Fortune 500 company. But when I came in 2003, DMC had lost $500 million in the previous 5 years. The board had voted to close Receiving Hospital and Hutzel Hospital. And the loss of receiving to this community would have been tragic. We have 100,000 patients a year seen in our emergency room, and half of those patients are indigent, either uninsured or on Medicaid. So if you think, what would have happened to those people if the receiving emergency room hadn't been there? For many, it would have been a life and death situation. Hutzel was even more disturbing. We deliver 5,000 babies, most of them from high-risk moms, 500 babies a year, 2 pounds or less. They're babies you could literally hold in the palm of your hand, and you'd be amazed how many of those babies go home healthy with their moms after 3 or 4 months. Those hospitals were on the verge of closing in 2003, and that was why the board recruited me for the prosecutor's office. But what I found out was everything I've been told wasn't true. You know, I heard the problem was Detroit. People don't want to come here. Doctors don't want to come here. Patients won't come down from Birmingham. That's the reason DMC is broke. I got in and found out that wasn't true, that 40% of insured Detroiters were leaving the city for their care. The problem wasn't people from Birmingham weren't coming downtown. The problem was people from 7 Mile weren't going to Sinai Grace, they were going to Providence. And it was because we were delivering a service in our emergency room 3 hours at a time. And so we attacked it, we turned it around, and we became profitable really right from the first year.
So the notion that for far as medical facilities, hospitals, that you saw a lot of closing over the years because there wasn't the financial support here in the city to pay for the services. So you're saying that wasn't necessarily the case.
Again, and that's what I was told, and what I turned out when I got there was it was bad management. There are lots of people who live in this city who have jobs and who have insurance. We needed to capture them. But that first year, remember, we went to the 29-minute emergency room guarantee. We redesigned everything we did. And that first year, if we didn't see you in 29 minutes or less, we gave you 2 tickets to a Tiger game. Now in 2004, where the Tigers were in last place, Mike Ilitch was willing to make that deal. He doesn't do that anymore. Now if we're late, we give you 2 tickets to a museum, but we still see 95% of our patients in 29 minutes or less. When we changed that, patients came back in huge numbers. The doctors followed them. The first year we made $2 million. The second year we made $13 million. And now 9 years later, we've been growing. And today, DMC has 2,000 more employees than when I started 9 years ago. So it's been a success built around the city of Detroit.
Let me say, I was actually born at the Old Grace Hospital, and so my family always went to DMC facilities. But I have my own personal testimony. You have really reduced the wait time from 20 minutes to actually 3-4 minutes, because I had an experience that I was feeling some discomfort, went in there and was seen by a doctor in about 5 minutes. So I was very impressed with that.
I think that might have been because of you, Jonathan.
Whatever. Well, look, we're going to talk about on the other side of the break, we're going to talk about the Healthcare Affordability Act and the impact that we should expect, if any, here in Metro Detroit. Specifically, how is DMC preparing for the new Affordable Health Care Act? Welcome back to the Jonathan Kinloch Show. Mike Duggan, a couple of weeks ago, we heard an announcement by Henry Ford Health System and Beaumont, basically planning a merger. Why are we seeing these major hospital institutions merging now? What's going on there, and what should there be any concern concern from patients as it relates to the healthcare options?
You'd have to ask Henry Ford and Beaumont what their financial circumstances were that they chose to do that merger. But from my perspective, we competed against Henry Ford and Beaumont before. Apparently, they're going to keep separate brands, and we're going to keep competing against them. So I don't know if there's anything in there that causes concern.
So it's not like one of the institutions will dissolve into the other?
I don't think that's what's going to happen. If anybody's nervous, it's probably the corporate staff of the two institutions, because you would think that there'll be some reductions there, but I'm not privy to those details. I would be surprised if the public saw a significant difference in care.
So there's nothing in the horizon that would create an environment where we would see some other mergers or even some dissolving of some of the healthcare institutions in our local area?
You know, the whole healthcare field is changing, and the Affordable Care Act is doing something really important. Today, doctors and hospitals make money the sicker you are. So you came to our emergency room, we got you home shortly, that was good. But normally, what we have with people safe with a chronic heart condition, you come to our emergency room, the doctors in the emergency room make money. We get you to x-ray, the radiologists make money. We get lab tests, the pathologists make money. We get you out of the floor, the cardiologist makes money, the hospital makes money. We discharge you. If you come back to the hospital 3 weeks later, we all make money again. The system was built that the more care you get, the sicker you are, the more money we make. What the Obama administration has said is we're going to change that. We're going to pay doctors and hospitals to work together to keep you well. And we're going to pay you more, hospitals and doctors, if you keep Mr. Kinloch healthy and home than if you keep admitting him to the hospital. And so that's a whole different way of thinking, because normally doctors and hospitals don't actually work too well together. And so to build those networks to keep people well, which means we need an educator about your diet, we need somebody to check your diabetes, we need somebody to be checking your blood pressure on a regular basis without you having to come to the hospital, those are going to take big networks of people. And so I think you will see bigger hospital systems. I think you'll see the standalone hospitals go away. Henry Ford Beaumont is a pretty major merger, and I'm not sure that's what drove it, but I do think you'll see more mergers going forward.
You just spoke about the relationship between doctors and hospitals and the impact of the healthcare President Obama's Affordable Healthcare Act. I always get it a little twisted there. But what is the impact from your perspective? You mentioned how there will be more preventive care involved, but how will it affect the bottom line and the cost and also the availability of health care for just average Joe and most individuals?
There are few places in America that are going to benefit more than the people of the city of Detroit. Starting in January 14th, just 13 months from now, if you're below 133% of the poverty level, which is essentially $30,000 for a family of four, you're going to be covered under Obamacare. Now, right now, you get Medicaid if you're disabled. You got to certify that you're disabled. People who have been through this know this, and the great majority get struck down as ineligible. Starting in January 2014, it doesn't matter. Everybody below that family of four, $30,000 is going to be covered, and they're going to be put into Medicaid HMOs. Now, DMC has bought an HMO, so you could be into the DMC product. You could be in Health Alliance plan. You could be in Bluecade. You could be in Total. You're going to have all those choices. There are 100,000 Detroiters who are uninsured today that are going to have a health insurance card, most of them for the first time in their life, in January 2014. That means those individuals will be able to go see a doctor. They won't have to show up at the emergency room as their first level of care. They'll be able to go see a doctor, be treated for their conditions on an ongoing basis. It's going to be a dramatic difference.
There's a couple of discussions that are taking place both in Washington and Lansing as it relates to health care. In Lansing, the governor has been trying to get the legislature to move on these health care exchanges, which I understand is a provision that's required under the Affordable Health Care Act. And the legislature at this particular point has chosen not to really move on that. There's I guess one of the provisions is either the state administers these healthcare exchanges or the federal government will.
So here's what we're talking about. I just talked about Medicaid, which is basically for people $30,000 and below. Between $30,000 and $80,000 for a family of four, you'll get a subsidy from the federal government, and you'll go on the so-called exchange and buy your insurance. It works just like Orbitz.com or Travelocity, where you go on and you can get a flight from United or Delta or American. It'll be the same thing, and it's now in Massachusetts because Governor Romney did, in fact, start this first in 2007. But you'll be able to go online, and so if you make $50,000 a year, you'll be required by law to get insurance. The feds will pay a significant part of your premium, and you'll go online and pick Health Alliance Plan, DMC Care, Blue Care Network, total care, and you'll see how much it pays for and what the scope of the coverage is. And so what Governor Schneider wants to do is either the feds are going to run that exchange, that orbitz.com site, or the state's going to run it. Governor Schneider, having been a computer guy all his life, thinks he can run it a lot better than the feds. He has not been able to get the Republicans in the House to go along with him doing it because it looked like they were somehow...
Plus, there's some savings that's involved in this. The state, I guess, the state will be able to experience a windfall by administering it. So I don't get it. The legislature is saying that the state needs more revenue. This is an option.
I think you'll see the state now go ahead and do it, because I think there was some sense that if Romney won the election, that the Republican legislators would have felt embarrassed having voted for it. I think now it's clear that Obamacare is going forward full speed. I think you'll see the legislature support the governor. I think you'll see the exchange in place, run by the state of Michigan, which is the right solution.
Well, when we come back, I want to talk to Mr. Mike Duggan about all of the construction that we're seeing around at the various locations at DMC's facilities. When we come back, I'll continue my discussion with Mike Duggan, CEO, or soon to be retired CEO of Detroit Medical Center. Welcome back to the Jonathan Kinloch Show. Mike Duggan, there's a lot of cranes and construction equipment moving around on various campuses of DMC. Now, we often hear about major public works projects that are taking place in the city of Detroit and the benefits that the community at large will have in job creation and vending opportunities. Well, so I'm going to ask you this. First of all, how large is the scope of this project that DMC has undertaken, and how is Detroiters participating in any economic boom that's being generated from these construction projects?
Well, the construction projects themselves are $500 million, which is the biggest private construction project anybody in the city of Detroit has ever seen. We're building a $100 million heart hospital at Harper. We're building a $77 million emergency room at Santa Grace. We just opened a children's pediatric center across from Children's Hospital. We're building a new children's tower. And it's all great for our patients in the community. Now, what did we do? We signed a project labor agreement with the Building Trades Union. All of this is being done with union labor. The City Council and the County Commission, when they approved the tax break for us, got provisions in the agreement that 50% of all workers on the job site will be from Wayne County and 25% will be from the city of Detroit. In addition to that, we agreed that half of the apprentices that work these sites would be minorities. And this is critical because for too long, the minorities have been excluded from the building trades. And so these are good paying jobs that we want to provide opportunities for the people of this community. We have exceeded every single one of those goals. You can just come and look at our work site and you will see a racial mix that's rare at any construction site in the state of Michigan. On the awarding of the contracts, more than 40% of all the work is going to Detroit minority and women-owned businesses. And so Jim Jenkins and his company are building the Heart Hospital. We've had a Brinker building the children's facility. And so Vanguard completely committed to this. We're not bringing in companies from Nashville. These are Detroit companies building our facilities with people from our community, and it's been great.
Often we hear about local businesses that are participating in many of these major projects, and they happen to be some of the big boys, many of the big boys that may not necessarily have a footprint in the city of Detroit. Oftentimes you have businesses that don't necessarily have the bonding capacity and some of those other requirements. And I mean, one of my main concerns is that often we don't see these entities or these corporations and projects actually trying to go out of their way to ensure that businesses that may not have all of the various different strengths that's necessary are able to participate? I mean, how has...
You're absolutely right, Jonathan, and Dave Minardo, who runs our construction project, has been all over this. And of course, one of the issues is some of the small minority women-owned firms don't have huge cash reserves behind them. And so how soon you pay depends on whether they can bid. And so after a request for some people, and actually a phone call from Council President Charles Pugh, we revised our practice and we are paying everybody within 15 days, which has opened up our subcontracting to a whole range of small companies from Detroit that never would have been there before. And I know you were at a meeting where you heard a testimony from a woman who said, I got into this because we changed this to a 15-day pay period. We want to reinvest in the city because it's city residents that are the basis of DMC's success, and it's worked out very well for us.
Well, I just really wish that we have a lot more projects. We have a lot of construction, as we see going on behind us, that a lot of other entities would have the same approach, because as you know, having served in public positions, a lot of times you have these contractors who come and complain about the lack of participation of minority and local-based businesses. How soon will all of these projects be completed?
The children's project, the pediatric center, was opened in May, so that was the first one that got done. The expanded emergency room at Harper will be open in January, and that will make things a lot easier there. The neuro unit at RIM, the place where we rehab stroke victims, was opened 2 weeks ago. $6 million project, and that facility is beautiful. We have the finest equipment anywhere for bringing stroke victims back. And then over the next year or so, the Heart Hospital, the Sinai Grace Emergency Room, and the renovated rooms at Detroit Receiving will all be done. Speaking
of Sinai Grace is definitely among all of DMC facilities are staples in our community. Sinai Grace and some of the other DMC institutions, how is that representative as far as the leadership at these hospitals? How have you been able to pull together leadership for these various facilities?
Well, we turned around DMC by recruiting Detroiters. When I came in, DMC was on the verge of bankruptcy, so anybody who could get out of town did. They went to Beaumont, they went to Oakwood, they went to St. John's. We built this comeback around Detroiters, and so as you know, the president of Detroit Receiving Hospital, Dr. Iris Taylor, is from Detroit. The president of Sinai Grace Hospital, Dr. Reggie Eady, is from Detroit. The president of Children's Hospital, Dr. Herman Gray, is from Detroit, products of the Detroit Public Schools. Dr. Gray has an extraordinary story. As a boy, he'd round with his father, who was a doctor, but as an African-American physician, couldn't get into the major hospitals, was confined to a couple of small black-owned hospitals. Today, Dr. Gray is president of a hospital his father could not get credentialed in. And so we've turned DMC around with talent from Detroit, and it's proven a very good formula for success.
Well, Mike Duggan, we cannot have you in this studio and not have a conversation about politics. And when we come back next week, we're going to continue our discussion with Mike Duggan and ask him about the political landscape here in Metro Detroit and the volatile relationship between Detroit and Lansing and the future prospects of him being mayor of the city of Detroit. I know of no safe repository of the ultimate power of society but the people. And if we think them not enlightened enough, the remedy is not to take power from them, but to inform them by education. That's what I hope we do here each week. And until next week, have a great week.